A deadly, drug-resistant fungus is spreading rapidly across the United States, and health officials are growing increasingly alarmed. Candida auris, or C. auris, has already been detected in 38 states, with cases rising at an unsettling pace. What makes this pathogen particularly concerning is its near-total resistance to antifungal medications, meaning infections are difficult, if not impossible, to treat. Once inside a healthcare facility, it lingers on surfaces, withstands standard cleaning procedures, and continues to infect vulnerable patients. Those with weakened immune systems, the elderly, and individuals relying on catheters or ventilators are at the highest risk, and in severe cases, the infection can lead to fatal bloodstream infections. The Centers for Disease Control and Prevention, CDC, has classified Candida auris as an urgent antimicrobial resistance threat, emphasizing the dire need for better surveillance, improved sanitation protocols, and more effective treatments. Yet, despite these warnings, the fungus has continued its relentless spread since its first U.S. detection in 2016. Now, it is reaching unprecedented levels. 5 states, California, Florida, Illinois, New York, and Nevada, have reported over 1,000 cases each, while many others are seeing a sharp uptick in infections. The CDC has not yet provided data for 2024 or 2025, raising concerns that the real number of cases may be even higher than currently reported. Unlike airborne illnesses such as COVID-19 or the flu, Candida auris spreads primarily through medical equipment, including breathing tubes, feeding tubes, and catheters. However, what makes it especially dangerous is its ability to persist on surfaces for long periods. Even after rigorous cleaning, traces of the fungus can survive, making hospitals and nursing homes prime breeding grounds. Once an environment is contaminated, the risk of infection increases dramatically, particularly for already vulnerable patients. Healthcare workers and visitors can unknowingly carry the pathogen from room to room, further accelerating its spread. Treatment options for Candida auris are grim. Standard antifungal medications are often ineffective, leaving doctors with few choices. While some cases respond to a class of drugs called echinocandins, even these treatments are failing against certain strains of the fungus. In the worst-case scenario, when the infection proves completely resistant, there is simply no cure. Patients with severe infections face a terrifying reality, fighting a disease that modern medicine cannot yet stop. The CDC has reported that mortality rates for C. auris infections range between 30 to 60%, though in many cases, the infected individuals already had underlying health conditions that increased their risk of death. Despite these dangers, public awareness of Candida auris remains relatively low. Unlike viral pandemics that trigger immediate concern, fungal infections often go unnoticed until they reach crisis levels. However, the rapid spread of C. auris should not be underestimated. Hospitals and healthcare facilities must implement stricter infection control measures, including enhanced disinfection protocols and routine screening for the fungus. For individuals, vigilance is key. Those with loved ones in healthcare settings should ensure that proper hygiene measures are being followed and that any unusual symptoms, such as persistent fever or chills, are reported immediately. The rise of Candida auris serves as a stark reminder of the growing threat posed by drug-resistant infections. The overuse of antifungal and antibiotic medications has contributed to the emergence of these superbugs, and unless new treatments are developed, the consequences could be catastrophic. The healthcare system is already strained under the weight of antibiotic-resistant bacteria. Now, a deadly fungus is adding to the burden. Without immediate action, Candida auris may become an unstoppable force, leaving countless patients with no viable treatment options. The time to act is now, before this silent epidemic spirals even further out of control.